Eyelid cysts, epidermal inclusion cysts, follicular cysts, infundibular type. These are cysts arising from plugged hair follicles or inclusions of squamous epithelium deep into the dermis following trauma. They have round or oval single lumen, lined by keratinized stratified squamous epithelium, filled with foul-smelling, cheesy keratin debris. The pore may connect lumen with skin surface, and rupture may induce a foreign body granulomatous inflammatory reaction. Sweat ductal cyst or sudoriferous cysts, apocrine hydrocystomas. This is a true adenoma of apocrine glands of Moll along the eyelid margin. Microscopically, it shows translucent cysts with multi-loculated wall, and the wall is lined by 2 layers of epithelium, whereas the eccrine hydrocystoma is a true ductal retention cyst of an eccrine sweat gland. It appears as multiple cysts, not confined to eyelid margin, with a flat wall, papillary projection, and 1 to 2 cuboidal cell lining. Sebaceous cysts, pilar or tricholemar cysts. These are cysts formed by obstruction of pilosebaceous glands. They appear as small rounded white mass at the hair follicle, with occluded pore. They are lined with palisade cells and contain oily secretions and desquamated epithelium. Dermoid cyst. Dermoid cysts are cysts formed by sequestered surface ectoderm along bony suture lines during embryogenesis. Dermoid cyst may be an external angular dermoid formed along zygomatico-frontal suture line, or internal angular dermoid formed at maxillofrontal suture line. Microscopically, it is lined with keratinized squamous epithelium, and the appendages include hair shaft, sebaceous, and sweat gland. Rupture of the dermoid cyst induces foreign body inflammatory reaction. Vascular anomalies of the eyelid and conjunctiva include congenital capillary hemangioma, which may be superficial or deep, acquired capillary hemangioma, nevus flammeus, eyelid varix, eyelid lymphangioma, eyelid glomus tumor, vascular tumors including Kaposi's sarcoma and hemangiopericytoma, capillary or cherry hemangioma. This is a hamartoma formed of abnormal capillaries lined with endothelium. It has a perinatal onset. It grows rapidly, then involutes, and induces a cosmetic blemish. It also induces upper eyelid ptosis with risk of amblyopia. Capillary hemangioma occurs as a periocular nasal cutaneous hemangioma in 90% of the cases, strawberry mark. Microscopically, it is formed of non-capsulated endothelial-lined vascular channels whose diameter is equivalent to capillary diameter. Nevus flammeus or port wine stain. This is congenital cutaneous port wine stain along branches of the 5th cranial nerve, the trigeminal nerve. It may be unilateral or bilateral, or may have systemic association as in Sturge-Weber syndrome and Klippel-Trenaunay-Weber syndrome. Nevus flammeus appears as sharply demarcated flat deep lesions that progress with age and has no blanching on pressure. It is mixed capillary and cavernous hemangioma. Eyelid varix. This is saccular dilatation of orbital veins that is located anterior to septum, and deep orbital varix induces proptosis. Microscopically, there are dilated vascular channels with clotted blood and thrombosis and phlebolith formation. Abnormal arteriovenous communication. Racemose or cirrhoid angioma. This is a rare developmental anomaly between arterial and venous system. It appears as large plexiform and serpentine vascular channels with associated AV communication of brain and retina. Microscopically, there are hypertrophied mature artery and vein and absent capillary bed. Kaposi's sarcoma. Kaposi's sarcoma is multicentric vascular neoplasm affecting skin, mucous membrane, internal organs, and lymph nodes. It originates from endothelial proliferation of lymphatic channels. The organism is herpes virus type 8 in immunocompromised patients, HIV positive. It is predisposed to by immunosuppression, as in Hodgkin's lymphoma and leukemia. Kaposi's sarcoma pathology. Site: Involve skin, mucous membranes, internal organs, and lymph nodes. Types WHO 2002. 4 different clinical and epidemiological forms of Kaposi's sarcoma are recognized. Classic indolent form, endemic African Kaposi's sarcoma, iatrogenic Kaposi's sarcoma in solid organ transplant recipient, acquired immunodeficiency syndrome associated Kaposi's sarcoma, which is the most aggressive form. All types, irrespective of epidemiologic subgroups, are human herpes virus 8 positive. Gross picture: cutaneous purplish, reddish blue, or dark brown macules, flakes, and nodules that may ulcerate, solitary or multiple. May be associated with lymphedema. Microscopic picture: vascular proliferation, often running parallel to the epidermis. Slit-like vascular channels lined by flattened or more oval endothelial cells with little atypia. Frequent extravasated red blood cells and hemosiderin deposition. Inflammatory cellular infiltrates formed of lymphocytes and plasma cells. Intracellular and extracellular eosinophilic globules representing fragmented red blood cells or giant lysosomes. Hemangiopericytoma. It is a benign tumor originating from vascular pericytes. It appears as well-circumscribed mass with capsule. Microscopically, there is vascular pericytes proliferation around large sinusoidal vessels, which are more numerous in periphery, the so-called staghorn configuration. The prognosis of hemangiopericytoma may be benign or malignant, causing metastasis in 12 to 45% of cases.